Hi guys, Heather here. So I'm sure most of us nurses and CNAs have experienced flirtatious comments from patients or family members, or maybe experienced a situation that might be a little uncomfortable, but most of the time we just brush it off like it's no big deal or play the game with them a little bit. But sometimes they just take it a little bit too far. The dementia patients you can kind of give a pass to, because sometimes you'll just be doing your assessment and you'll turn around for a little bit and they'll be like trying to pat you on the bottom. Or this one patient I had, I'd say, hey, how you doing? And he'd be like, I'm good, give me a kiss. It was kind of funny because he'd say that to everybody who came in the room. And then you have your other patients who aren't usually demented, and they'll comment like what long legs you have and that you look great in a mini skirt, or maybe ask you if you have an eating disorder. A couple of my most embarrassing moments have been with the younger fellows who can't seem to keep their hands off themselves while they're in the hospital, and I'll walk in on them and see a moving motion under the blanket, if you know what I mean. And that's all I have to say about that. Luckily, they're too busy to notice that I've walked in the room, so I just walk right back out and come back later when they're not so busy and pretend it never happened. But it's been a lesson for me, because since then I've learned to knock and make some noise before I come in the room, so I never have to witness that again. And then there's always that weird catheter insertion moment. Mine involved a 50-year-old guy, a little bit confused, and I was preparing my betadine and cotton balls and catheter lube and all that good stuff. And so I warned him, I'm like, okay, I'm gonna clean the area with betadine and it's gonna be a little bit cold. And as soon as I cleaned with the first cotton ball, he's like, oh, that feels good. Okay, well, that's not what I was trying to do, but I'll just pretend I didn't hear anything. So then I continue to do my catheter, and soon enough I notice he's like trying to reach over and grab my behind, and I'm like, okay, don't do that. And he's like, well, why not? If you can touch me, I can touch you. Okay, well, then I guess I better stop doing this catheter then. I think you're getting the wrong idea, buddy. This is the hospital, not the red light district. Those situations are not ideal, but they happen. And if you haven't experienced them yet, you will. Well, guys, thanks for watching. Talk to you soon, okay? Bye.